Hello, I'm Dr. Manson, and today we're going to talk about something that affects a huge number of people but is often underestimated: colon inflammation, diverticulosis, and constipation. These conditions are much more connected than most people think, and understanding them can significantly improve your digestive health. Let's start with the basics. The colon is the final part of your digestive system, and its main function is to absorb water and form stool. When this system starts to malfunction or becomes inflamed, symptoms begin to appear, symptoms that many people normalize, even though they are clear signs that something is wrong. Colon inflammation can present in different ways. It can be mild colitis, it can progress to pancolitis, which is a more extensive inflammation, or it can appear as diverticulosis, where small pouches form in the colon wall. Even though these conditions sound different, they often share similar causes and, most importantly, a common root: lifestyle. One of the most important factors is diet. A diet low in fiber and high in ultra-processed foods, refined sugars, unhealthy fats, and low water intake completely disrupts the gut microbiota. This imbalance promotes inflammation, poor digestion, and irregular bowel movements. Alcohol also plays a role, as it directly irritates the intestinal lining. Another key factor is obesity. Obesity is not just a cosmetic issue, it's a chronic inflammatory state. The body remains in constant low-grade inflammation, and the gut is no exception. This increases the risk of conditions like colitis, irritable bowel syndrome, and worsens constipation. There are also medical conditions that can contribute to these problems, such as irritable bowel syndrome, Crohn's disease, or ulcerative colitis. Even intestinal infections or frequent antibiotic use can disrupt the gut flora and trigger inflammation. But there's something I want to emphasize very clearly. Constipation is one of the most important and most overlooked causes. Many people think it's normal to have a bowel movement every 3 or 4 days, but it's not. Constipation causes stool to remain in the colon longer, increasing internal pressure, promoting the formation of diverticula, and leading to progressive inflammation. So what causes constipation? The main factors include low fiber intake, inadequate hydration, lack of physical activity, stress, and microbiota imbalances. It can also be related to hormonal issues or the excessive use of laxatives, which in the long term actually worsen the problem. Now, how do we know if our colon is inflamed? The body gives us several warning signs that we should not ignore. One of the most common is abdominal bloating, that constant feeling of being swollen. There can also be cramping pain, excessive gas, constipation or diarrhea, and something very important: the feeling of incomplete evacuation. In some cases, you may notice mucus in your stool, and in more serious situations, blood, weight loss, or persistent pain. These are red flags and require medical attention immediately. This leads to an important question: when should you see a gastroenterologist? If constipation lasts more than 2 to 3 weeks, if there is blood in your stool, frequent abdominal pain, or noticeable changes in your bowel habits, you shouldn't ignore it. Also, if you have a family history of colon disease, it's important to get evaluated. Now let's talk about what you can actually do, because the good news is that many of these issues can be improved. Diet is the foundation. You need to increase fiber, but do it intelligently. Soluble fiber is especially helpful, and you can find it in foods like oats, chia seeds, and flax seeds. Cooked vegetables are also recommended because they're easier to digest, along with fruits like papaya and apples. Fermented foods like yogurt can help because they provide beneficial bacteria. And something that sounds simple but many people overlook: drink enough water. Without proper hydration, fiber simply won't work. At the same time, you need to reduce what's harming your gut: ultra-processed foods, alcohol, excessive sugar, highly irritating foods, and excessive red meat consumption. When it comes to supplements, you don't need to overcomplicate things. There are 2 that can make a significant difference. The first is probiotics, which help restore the gut microbiota, reduce inflammation, and improve bowel movements. Look for high-quality products that contain strains like lactobacillus and bifidobacterium. The second is soluble fiber in the form of psyllium. This supplement is very effective because it regulates bowel movements. improves constipation, and helps reduce inflammation in the colon. Optionally, some people may benefit from glutamine, which supports the intestinal lining, or magnesium if constipation is present. But with the first two, you already have a strong foundation. If you suffer from constipation, there are basic steps you should follow. Gradually increase fiber intake, drink enough water, stay physically active, establish regular bathroom habits, and don't ignore the urge to go. At the end of the day, your colon is a direct reflection of your lifestyle. If you eat poorly, don't move, live under constant stress, and ignore your body's signals, sooner or later it will show. But the opposite is also true. When you make the right changes, your gut responds very well. So start with the basics, do them consistently, and if you notice warning signs, seek medical attention early. Your digestive health is essential for your overall well-being. I'll see you in the next video.